Good day everyone, I am Camille Jumpa from BSN 1A. Today I will be demonstrating the vital signs taking, which are include the temperature, pulse, respiration, and blood pressure. So the definition is, vital signs taking is a procedure that provides data that reflect the status of several body systems that includes cardiovascular, neurologic, cerebral vascular, and respiratory systems. The science of basic physiology is reflected in body temperature, pulse, respiration, and blood pressure. So the measured temperature, first followed by pulse, respiration, blood pressure, and oxygen saturation. So the purpose is to assess the client's condition, to determine the baseline values for future comparisons, and lastly is to detect changes and abnormalities in the condition of the heart. So, when to take vital signs? First is upon admission as ordered, any change in status with chest pain or any abnormal sensation, before and after administration of preoperative medications, after surgery of invasive diagnostic procedures, before and after administration of blood products or medication that can cause cardiovascular and respiratory changes. And lastly is before and after any nursing intervention that can affect the cardiovascular or respiratory system. So, the materials or equipment that we are going to use is thermometer, stethoscope, sphygmomanometer with appropriate cuff size, watch with second hand, pulse oximeter, swab or cotton ball sock with alcohol, sponge towel, 2 paper bag, record form sheet, ballpen pen, blue, black, red, 1 each color, 1 tray to set all equipment needed, and lastly is toilet paper. Measuring temperature or temperature taking. The definition is the process of measuring or monitoring the patient's body temperature using a clinical thermometer. It may be taken through the axilla, orally, or through the tympanic membrane. Normal axillary temperature range is 35.4 to 37.0 degrees Celsius. The normal oral temperature is 35.9 to 37.5 degrees Celsius. The normal tympanic temperature range is 36.7 to 38.3 degrees Celsius. Temperature below 36.7 degrees Celsius is represent hypothermia and can be a result of prolonged exposure to cold, hypoglycemia, hypothyroidism, starvation, neurologic dysfunction, or shock. The temperature above 38.3 degrees Celsius is represent hyperthermia and can indicate bacterial, viral, or fungal infections, inflammatory process, malignancies, trauma, or various blood, endocrine, and immune disorders. The purpose is to determine body temperature, to assess in diagnosis, to evaluate patients' recovery from illness, to determine if immediate measures should be implemented to reduce dangerously elevated body temperature or conserve body heat when body temperature is dangerously low. And lastly is to evaluate patient response once heat conserving or heat reducing measures have been implemented. So the definition of heart rate is a measurement of the heart rate or the number of times the heart beats per minute. As the heart pushes blood through the arteries expand and contract with the flow of the blood. So the purpose is to determine number of heartbeats occurring per minute, to gather information about heart rhythm and pattern of beats, to evaluate the strength of pulse, to assess heart's ability to deliver blood to distant areas of the body, to assess response of heart to cardiac medications, activity, blood volume, and gas exchange, and lastly is to assess vascular status of lives. So, the materials or equipment that we are going to use is watch with second hand. Different sites in taking pulse rate. In the pulse site, we have radial. The reasons for use is radially accessible and routinely used. And then, second is temporal, used when radial pulse is not accessible. Carotid, used for infants in case of cardiac arrest and to determine the circulation to brain. Apical, routinely used in infants and children up to 3 years of age, used to determine the discrepancies with the radial pulse and used in conjunction with the same medication. Brachial, used to measure blood pressure, used for cardiac arrest for infants. Femoral, used in cases of cardiac arrest for infants and children. Determine circulation in the leg. Popliteal, used to determine the circulation in the lower leg and leg blood pressure. Posterior tibial, used to determine the circulation in the foot. And lastly is pedal, used to determine circulation in the foot. So, the definition of respiration, the number of breaths per minute, or more formally, the number of movements indicative of inspiration and expiration per unit time. In the practice, the respiratory rate is usually determined by counting the number of times the chest rises or falls per minute. The time of measuring respiratory rate is to determine whether the respiratory are normal, abnormally fast, abnormally slow, or non-existent. So, normal range, below 6 months, 30 to 60 BPM. And then, 6 to 12 months, 24 to 30 BPM. And then, 5 years, 20 to 30 BPM. And then, 6 to 12 years, 12 to 20 BPM. And lastly is 12 years to adult, 12 to 20 BPM. So, the purpose is to provide valuable information about a client's physical and emotional health. So, the equipment that we are going to use is watch with the second hand. In blood pressure taking, the definition is pressure exerted on the wall of the arteries when the left ventricle of the heart pushes blood into the aorta. So, the purpose is to determine vascular resistance to blood flow, and then to determine the effectiveness of cardiac muscle in pumping blood to overcome the vascular resistance. So, the materials or equipment that we are going to use is, the first one is blood pressure apparatus. The second one is sphygmomanometer. The third one is stethoscope. And the fourth one is paper and pen. And the last one is cotton ball soaked with alcohol. Good morning, ma'am. I am Camille Dumpay, your student nurse for today.
Good morning.
Okay, ma'am. So, I have a few questions. Is that okay with you?
Yes.
Okay, ma'am. May I know your phone name?
I'm Princess May Madelo.
Okay. So, how old are you, ma'am?
I'm currently 19 years old.
Okay. So, do you have any occupation, ma'am?
As of the moment, no, because I'm still a student.
Okay. So, have you been hospitalized before?
No.
Now I am going to check your temperature. Is that okay with you?
Yes.
For the assessment, assess client's skin if warm to touch. Assess for most appropriate site to check the temperature. For the planning, we need to wash our hands first. Then, gather the equipment needed.
Mom, I am going to check your oral temperature. Is that okay with you, Mom?
Yes.
Mom, I am going to check your tympanic temperature. Is that okay with you, Mom?
Yes.
Mom, I am going to check your pulse rate. Is that okay with you, Mom?
Yes.
Okay, ma'am, I am going to check your respiration. Is that okay with you, ma'am?
Yes.
Okay, ma'am, I am going to check your blood pressure. Is that okay with you, ma'am?